Yeah, as we said earlier, look, we keep getting told that you have to wash your hands. It's one of the keys to stopping the spread, but we all have to buy into it. And we're joined now by Kate Orkin. She's Research Fellow in Behavioural Science at Oxford University. Kate Orkin, is this the kind of incident, crisis, whatever you want to call it, that does get generally people to act in the common good?
Absolutely. So behavioral science definitely tells us that when we strongly and normatively appeal to people to do the right thing, overwhelmingly they will do it. And people are also most strongly influenced by the behavior of those around them. So if they see other people sticking to the public health advice, they're much more likely to do it as well.
So what about the issue of quarantine? Because obviously millions of people in China have been on lockdown. We've now had lots of people in northern Italy who have had to be in self-quarantine. Do you think in westernized societies that are pretty individualistic, people will buy into self-quarantining for 14 days if it comes to that and if lots of people need to?
I think if people see that there's an overwhelming social norm, that's really what is expected, it is likely that people will stick to it. We haven't had a crisis like this in recent times in Britain, but overwhelmingly in many other places, so for example, recent water crises in Bogota or in Cape Town, cities have overwhelmingly pulled together to make sure that they do what's in the common good. So I think recent evidence does suggest that it's likely that people will stick to quarantine. And in fact, in China, a lot of, we think it's been an authoritarian response, but actually a lot of the time people have been self-imposing the behavior. It's not that they've been forced to do it.
And yet, Kate, when the authorities say, look, stop buying masks, stop buying hand gel, it's not going to stop you getting the coronavirus, stop stockpiling all the food in the kitchen, people still do it. Why?
So it's an interesting thing about messaging. So we actually have behavioral science evidence that says when you say to people, everybody else is doing this bad thing, they think it's okay, and then they do it as well. So it's really, it's an issue about the messaging. So actually when there was a forest where lots of people were removing wood, and they put up a sign that said, lots of people have been removing the wood, and the wood, more people removed the wood. And then they put up a sign that said, please do the right thing, don't remove the wood, and then people did the right thing. So it is a little bit more about appealing to people's better judgment rather than saying, this is what everybody is doing.
Okay, so the government today has said that at some point it's inevitable that we're going to move to the delay stage. They're going to have to, people are going to have to work from home. They're going to have to change their routines. Is there something as families, every family, can we do something? Can we plan for the weeks that are coming?
So I think, people's initial response has been, in some instances, to panic buy. It's really important that people understand the psychology behind why they're wanting to do that. So there's evidence that people panic buy particularly useful things when they're feeling a loss of control. So it's not actually that you need 20 bottles of hand sanitizer, it's that you're trying to deal with a sort of psychological need. There are lots of ways that you can feel a little bit more in control of this situation. One of them is to make a specific plan for yourself about how you're going to stick to the recommended behaviors. It's actually really hard to make sure that you're washing your hands all the time. But there's a lot of evidence that says, make a very specific plan about how you're going to do it, when you're going to do it, who's going to be doing it. The second thing you can do is help family and friends to make those plans and encourage those around you in the workplace to make those plans and to stick to them. And then you get this sort of good social equilibrium where everybody's sticking to the good behaviors. So there are things that people can do to feel more in control, but it's also really important that we interrogate our psychology and our sort of initial instincts quite a lot and understand a little bit of the science of why we're doing certain things.
Okay, Kate Orkin, thank you very much. So next time you're in the supermarket and you're thinking of buying a can of tuna to stock up, go and wash your hands.
We hope that our programme has answered some of your questions in recent week, which is important because each and every one of us has a role in this to try and slow the spread. Indeed we do, and of course the new term that we're all using is social distancing, which I think is a fancy term for defending your own personal space. We're joined by behavioural scientist Kate Orkin from Oxford University. I'm really struck actually over the last day when you go into other offices
how difficult it is to break these social norms, shaking hands. People don't know whether to elbow or to touch feet. It's difficult, isn't it?
Absolutely. I think the biggest influence, particularly when people are trying to prevent themselves against risk, is what people are doing immediately around them. So there have been a lot of experiments that have shown that, and people find it very difficult to break a sort of immediate social norm. But that's partly why it's really important that individuals start taking action to comply with the government's advice.
We were talking to Jeremy Hunt earlier in the programme, the former Health Secretary, about the nudge unit within Downing Street and how they're trying to double guess what people will do. There was an interesting thing last night. Paris Saint-Germain were playing Borussia Dortmund in Paris. They closed the stadium, so they were playing to an empty stadium. And what did the fans do? But they all turned up outside the stadium. There were hundreds of them all jumping up and down. So even though you close the stadium, it doesn't work.
It's really important to be very clear in the messaging that is going out. So I think there's a really hard balance of not making people panicked, not making people feel insecure, but at the same time really appealing to them to do the right thing to protect vulnerable people in society. I would say we really know from the science that people are very responsive when you appeal to them to do the right thing, when you appeal to their kind of core morality. And we've seen that in recent days in Italy, the government has managed, a fairly effective compliance with the shutdown because the Prime Minister and many other officials have really come out and used strong language appealing to people to do the right thing. They've said our grandfathers were asked to go to war, we're being asked to stay at home. It's a strong appeal to people's moral duty, and they're absolutely in line with the science that really does help to get people on side with the public health advice.
And what role does language have to play in all of this? I was thinking here in New York, 5 miles from where I am, there's an area essentially in lockdown, but you won't hear a politician use that word lockdown.
So I think, language is important in what people's sense is of what's going on. One example is that it's really important that you appeal to people to do the right thing. In contrast, when you tell people everybody is doing this bad thing, then in fact that increases the rate of people who do the bad thing. So it's important that you set the good social norm, even if that's not what people are doing at that point in time, and that encourages everybody to move into a sort of better equilibrium. But shouting at them for doing the bad thing is actually not particularly effective.
But we were just looking at pictures of empty shelves. People have been rushing to buy toilet paper. It's one of the questions I've had. Why toilet paper? What is it about coronavirus that's what they sort of jump to?
So there's actually been some interesting work by Andy Yan at INSEAD that's shown that when people feel a lack of control, they are more likely to buy sort of items that have a clear utility, a purpose. It makes them feel like they're doing something constructive. So I imagine, toilet paper feels like something that's going to be useful. But it really is about, it really is an emotional response. And I think part of how that emotional response can be managed is by, people deciding that they're going to think a little bit harder about how they're feeling and try to manage it. Of course, we also saw that supermarkets managed it very effectively by nudging people a bit in the right direction by saying you can only buy a certain, you can only buy 5 toilet rolls. And that was a very effective response.
Kate Orkin, thank you for asking that burning question.